The northern region has recorded a total of 704 suspected measles cases in 16 districts between January 2022 and March 22, 2023. 205 of these cases have been confirmed to be positive after laboratory tests in 12 districts with 0 confirmed deaths. Out of the 12 affected districts, the Tamale metropolis tops the charts with 116 cases since the outbreak. Speaking in a Citi News interview on the sidelines of the 2022 Annual Health Performance Review meeting, the acting regional director, Brema Baba Abubakar, said the region has seen a decline in measles cases.
We are still in the outbreak situation. Even though, like I said, we reached our peak on the 5th week. That was the first week in February. That was when we reached our peak. And then the figures started coming down. So it means we don't have 0 case yet. We still have new cases reporting every week. But the figures are not as high as when we reach the peak. Where in that particular week, we recorded over 100 suspected cases.
The outbreak coincided with a shortage of vaccines across the country. However, the director noted that all districts have received their vaccines for routine immunization.
So once we received the vaccines, we distributed them to all the districts. That will also do further distribution to sub-districts and to the community level for the routine immunization or vaccination to continue. These vaccines we received were not quantities that we can do mass campaigns to catch up with everybody. But at least to continue the routine immunization, routine means that, the vaccines, every child and the age at which you receive certain type of vaccines. So therefore, we made it available now so that when mothers send their children who are due for these vaccines, they will receive. And those who miss it, if they also attend the facilities, they will also receive it. The mass campaign would have meant that we would have deployed our staff to go to the communities, to go to every corner, to provide this service. But for now, the vaccines are stationed in our routine child welfare clinics, and then the mothers send the children there for the routine immunization. So until maybe we get another consignment, that will determine whether we can do a mass campaign or not. But for now, what we receive is for the routine vaccination. And so far, we've not had any facility or district coming back to tell us that within the week that we gave it out, they've run out. So routine immunization is ongoing.
The annual health review meeting afforded stakeholders the opportunity to take stock of their achievements and failures during the year under review. The region has achieved some successes in terms of institutional maternal mortality, which has seen a downward trend from 144 per 100,000 live births in 2019 to 95 per 100,000 live births in 2022. That notwithstanding, health officials have bemoaned the lack of logistics, including motorbikes for outreach and monitoring in rural areas, thereby affecting health service delivery in the region.
Other challenges confronting the region has to do with inadequate availability of motorbikes needed to do outreach services and monitoring and supervision in many of our sub-districts. Basic equipment is also woefully inadequate, especially in the lower level facilities.